Hello, welcome to our virtual radiotherapy information session. This is designed for anyone soon to receive treatment for prostate cancer. Remember, you can come back at any time to watch bits that you've missed again, or pause it to take a tea break. I'm Lara, one of the radiographers in the Prostate Information Team. In this video, you will hear from a few others, so don't be alarmed when the voice suddenly changes. John, Sina, Mulaney, and myself. You will meet us all in person during your treatment, so you may recognise our voices. We all hope that this video gives you the information you need and helps you to understand the radiotherapy process. So, first question, what is radiotherapy? Radiotherapy is a treatment option for prostate cancer as well as many other types. It can be used after surgery, instead of surgery, or alongside hormone therapy. If you are watching this, you will likely be considering which treatment option is best for you, or perhaps have already made the decision to have radiotherapy and just want more information about what happens next. Hopefully, we can answer all your questions, but if we don't, you can always contact us at the Radiotherapy Department. First things first, to understand our reasoning for certain things, it would be useful to help you understand a bit about the prostate and surrounding anatomy. Have a look at the pictures as we go through. This is an image that represents the prostate. Here we see the area that we are treating. Some people may receive treatment to nodal volumes that follow the bony anatomy of the pelvis as well, depending on what your consultant decides you need. This image shows us the bladder in blue. You can see that the bladder is in close proximity to the prostate. Therefore, we must consider it when we design the treatment because it gets some of the radiation dose. This is why we give you a drink to ensure you have a full bladder during treatment. We will explain more about that later in the video. Finally, in pink, we can see the rectum, which is the lowest end of the bowels, is also in close proximity to the prostate. The rectum is changeable in shape and can be a different size every day. Your diet and normal bowel habits will impact what shape and size is normal for you. Each day, we would like you to have a full bladder and an empty rectum. Now that we've explained where we are aiming, we can localise a precise area using our planning CT scan. This gives us all the X-ray information that we need to develop your treatment plan. I'd like to introduce you to John, who is going to discuss the CT scan process.
A week or two before your treatment, you'll have a planning CT session. This is to make sure the radiographers know the exact position, size and shape of your prostate. It will help them make sure the radiotherapy is aimed at your prostate and that the surrounding areas get as little radiation as possible. A week before your CT planning appointment, your radiographer will let you know how full or empty your bladder and bowel should be during the treatment. This helps to make sure that your radiographer treats the right area equally each time. They'll explain how much to drink and how to make sure your bowel is empty. They will ask you to start drinking fluids regularly throughout the day, maintaining an intake of at least 1.5 litres per day, preferably water. This will ensure you remain well hydrated and be able to achieve a full bladder during your planning session. 4 days leading up to and before your CT scan, you may be given an enema, which is liquid medicine. These are put inside your back passage and will help make sure your bowel is completely empty. On the day of your scan, before you attend your appointment, try to empty your bowels and bladder. Arrive 45 to 60 minutes prior to your CT appointment and drink approximately 500 millilitres of water when prompted by a radiographer. At the CT appointment, the radiographer will explain the procedure and position you on the treatment couch. During the scan, they will check the volume of your bladder and bowel. If the bladder is not full enough, the radiographer will inform and ask you to drink more water. Alternatively, a bladder which is too full may need some emptying. If the bowel is distended with solid or gas, the radiographer will ask you to try and go to the toilet again to empty. The scan can be repeated on the same day or may be arranged for an alternative day. Please do not be concerned if this happens. Your radiographer will make 3 very small permanent marks, tiny tattoos, on your skin. This will help to get you into the right position when you go for each treatment.
Thank you, John. So, how do we use the CT scan to develop your treatment? Now I'll explain. After the CT scan, a team of planning radiographers, physicists, and doctors will develop the radiotherapy treatment plan specifically for you. This can normally result in a 2-week wait between the planning CT scan and starting treatment. You will receive a telephone call as soon as the treatment plan is ready for you to start your radiotherapy treatment. First of all, using our computer system, all the surrounding organs are digitally outlined. This allows the radiographers to ensure that the organs are not receiving too much radiation. We have safe tolerances that we must keep within. As you can see in this image, when we deliver the radiation beam, seen in translucent yellow, it passes from outside to inside the body. So the radiation can affect surrounding healthy tissues on its way to its target, and this results in the radiotherapy side effects. Due to the radiation inevitably passing through the bladder and bowel tissue, the most common radiotherapy side effects are loose bowels, urinary frequency or urgency, and fatigue. This will be explained in more detail during the consent procedure and during the discussion prior to your first treatment. The radiation is shaped by blocking out the bits we don't need using metal pieces inside the machine, which helps us to spare the healthy tissues and reduce side effects. As you can see in this picture, the metal leaves collimate or shape the radiation beam exactly to the shape of the prostate. These mechanical metal pieces slide in and out as the machine moves around you to ensure that the prostate is getting the right amount of radiation at every single angle. The treatment builds up over time. Each session adds up until the full dose is reached at the end of the treatment course. This means that it is unlikely that you will experience side effects during the first few days of treatment. Any that do develop during treatment will worsen over time and get to their peak reaction 7 to 10 days after the treatment has finished. Our bodies take time to deal with the impact the radiation treatment has, so it can take 4 to 6 weeks post-treatment to return to normal. This is a usual occurrence, and the team here are available for support, advice, and any required medication during that time. The treatment plan is designed to deliver the full prescribed dose to the prostate and lymph nodes if they're being treated. Then, we split the total dose up to cover 4 to 7 weeks, depending on your treatment plan. Splitting the treatment up allows gaps between radiation doses so that your body can heal itself and reduces the side effects that you may experience. This is why you come in every day for a little bit of treatment at a time. Our bodies require water to heal themselves, so keeping yourself hydrated is very important. Practice drinking more water during the day now to help maintain your hydration. So, what happens on your first day of treatment? We have the plan all ready now. We've let you know what date and time you need to be ready to start treatment, and the first day has arrived. What happens next? Sina will explain.
As you arrive into the radiotherapy department, you'll be asked to report yourself at the reception. Then, you'll be directed to take a seat at the main waiting area and wait until your name is called out to enter the treatment room. As you enter the treatment room, you will see the LINAC, that is the linear accelerator, the machine that will be delivering your treatment. The aim at this stage is to get you in the same position as you were for your CT scan. You will be lying on the treatment couch with the same immobilization devices that were used at that stage. While lying down, the radiographers will need to see the 3 tiny permanent marks that were given to you. They will align the 3 permanent marks with green lasers in the room. This may involve them moving you physically around until this is achieved. Once the permanent marks are aligned, it is important that you keep very still. Following this, you may notice the radiographers carrying out calculations and moving the bed while you're lying on it. This is done in order to get you in the right position within the room. Once you are in the right position, you will notice the imaging arms of the machine moving out as shown in the image. The radiographers are moving the machine into position for the next step. Once they have done that, the radiographers will alert you that they are leaving the room. As they are leaving, you will hear this sound. This sound alerts everyone that the radiographers are leaving and that you'll be on your own in the treatment room. But there are CCTV cameras that allows the radiographers to monitor you closely at all times from the control area, that is the place where they'll be delivering the treatment from. So if there are any concerns, you can raise your hand to alert the radiographers and they will come in to assist you. If there are no issues, it is important that you keep very still. Before any treatment is being delivered, a CBCT will be obtained of you while lying on the bed. A CBCT is a form of a CT image. This image allows the radiographers to ensure your bladder is big enough, that your rectum is not too big, and to ensure the area to be treated as highlighted by the doctor when planning your treatment is covered. In addition, the radiographers can fine-tune your position. Hence, once they have looked at the image, you might notice the couch you're lying on moving a little, adjusting your position if necessary. If the radiographers notice that your bladder is not big enough, or your rectum is too big, they will come into the treatment room and inform you of this. They may get you off the treatment couch and provide you with instructions accordingly as to improve your bladder size or reduce your rectum size so that your treatment can be delivered on the day. Once they have assessed the image and are happy, the radiographers will deliver the treatment. You will notice the machine moving around you as it delivers the treatment. You will not feel anything or see anything. You may hear the machine working, producing a buzzing sound. Once the treatment is completed, the radiographers will come in and inform you. They'll get you off the bed and then you're free to go.
Well, now we have discussed all of the treatment information. It is quite a lot to remember, but don't worry. You will have plenty of opportunity to ask us questions. Melanie will now give you some other useful information that will help your treatment to run smoothly. Remember, if you need to recap anything, just rewind the video. Over to you, Melanie.
In the radiotherapy department, there are a lot of treatment radiographers. We don't expect you to remember all of us, but please know that we are all there to support you throughout your treatment. We will ask how you are every day. This is your opportunity to discuss with us any issues or side effects you may be experiencing or developing. If there is anything you don't wish to speak to us about, we can arrange for the Macmillan radiographers, Alex or Shelley, to either phone you or see you. As previously explained, hydration is very important during your radiotherapy treatment. Therefore, we will give you a water bottle to encourage hydration and also for you to use to measure your drink for your treatment. In the hospital grounds, there are specific yellow parking bays for oncology patients located opposite Woodlands as you approach entrance 15, which you can use for each of your visits. If these are full, you can park in any of the patient or visitor car parks. We will give you a parking permit slip, which allows you to buy one £3 parking ticket and gives you 10 visits. Once this runs out, please just ask at reception for a new one. As you enter the Wolverston wing, you may notice the Cancer Information Centre on your left. They are open most days and are manned by a team of employees and volunteers. They offer several different types of support to cancer patients and their families. This can be from the gentlemen's club groups to art therapy and financial support. They are there for you to access if you wish to. This can be before, during or after your treatment. They are also open just for tea, biscuits and a chat.
Thank you for explaining all of that for us, Melanie. As I have said, there will always be opportunity to ask us questions during your treatment. In the meantime, though, you will have your Macmillan radiographer Alex as your key worker and main contact. He is always readily available to offer support and answer any questions regarding your treatment. Now that you have all the information you need before you start your treatment, do you feel a little more prepared? We look forward to speaking to you in person when you come for your treatment. In the meantime, drink plenty of water and keep yourself hydrated. Thank you for taking the time to watch this video.